My colleagues on the front lines of healthcare and hospitals are broken. They were broken before this announcement.
Many scientific experts say they are at a breaking point when it comes to trying to understand the new pandemic rules in place for Ontario.
I'm really at a loss for how we got to where we are.
It is incredibly demoralizing for a government to ignore wise advice. And, several people have suggested that it feels like we're being played. And, I do wonder.
On Friday, the province announced restrictions to many outdoor activities, reduced capacity limits to stores, and closed non-essential construction.
The reality is there are few options left.
But some members of the Ontario Science Table say that is simply not the case. The independent group says there are things that can be done to address the causes of COVID-19 spread. In their briefing, experts called for immediate support for essential workers and high-risk communities, namely paid sick leave and vaccinations for high-risk people.
We know it's transmitted indoors in the workplace and in other gatherings. And they largely turned a blind eye to much of that.
Paid sick leave was not part of the Premier's announcement Friday. When asked about the issue, a spokesperson referred Global News to the Canada Recovery Sickness Benefit, a federal program people in Ontario can access. However, advocates have long said the benefit is difficult to get, and people have to wait too long, meaning they keep going to work sick.
This is not going to have any kind of significant impact. All it has done is anger people, it's alienated people, and it's made them mistrustful of government.
Some frontline workers remain unconvinced any of these new rules will help.
I don't think it's going to curb the transmission. I don't think it's going to curb the number of people ending up in hospitals, ICUs, and finally the number of people who are going to die.
Katherine Ward, Global News, Toronto.